want to introduce first a friend of mine, good friend of mine, Pat Eiding, the president of the Central Labor Council of the AFL-CIO in Pennsylvania. Been a big supporter of healthcare and other good causes ever since he's been head of the CLC. He's going to introduce our first keynote speaker. Pat.
Thanks, Mark. Good afternoon, brothers and sisters. You know, summer's over, and there's a whole lot of people out there trying to scare us into believing that there's something wrong with this country. We know there's something wrong with this country right now because there should be health care for everybody. And so we're not going to let that happen, because guess what? We do our best work in the fall. We get people like President Obama elected in the fall. So we're here at this rally. You know, the insurance companies are concerned because we might eat into some of their profits. We're not trying to take away the insurance company. We're just trying to see them be a little bit fair. We want them to share some of that so folks can have health care. 50 million people without health care in the United States of America is not acceptable. We won't accept it. So look, we have rallies like this all over the state of Pennsylvania today. We have rallies all over the country today to say to insurance companies, no more, no more. Now, fortunately, you know, all those rallies that are going around the state and the country are doing some great work, but they don't have the executive vice president of our AFL-CIO with them. We have her. Arlene Holt Baker is here with us today, and she's going to let these insurance companies know that she speaks for all working people. She speaks for the people in this country who need help, who need some support. It's not just organized labor. It's all those folks out there that can't take their kids to get needles, can't get a vaccination. They can't take their mother when she's sick. All those people are our people, not just organized labor. And Arlene Baker Holt speaks for those people. She speaks for us, but she speaks for all working people. And she's here today to tell the insurance companies no more. Arlene?
Thank you so much, Pat. Do you guys think enough is enough? Is it time for health care? Have we waited long enough in this country for health care reform? The time is now. All across America today, people have something to say about these big insurance companies. And what they're saying is, we're sick of it. Let them hear us say it. We're sick of it. It's not just here in Philadelphia, and not just CIGNA either. We're sick of WellPoint and United Healthcare and the rest of the insurance giants who have a chokehold on American health care. We're sick of it in Hartford and in Indianapolis. We're sick of it in Milwaukee and Minneapolis. We're sick of it in dozens of other cities across the country where events like this are taking place today. It would take all the time standing here to talk about where these events are occurring, but we're sending the same message everywhere around this country. Now let me just say that in every state from coast to coast, we're sick of what? Big insurance. We're sick of it. We're sick of insurance companies telling doctors what they can and can't do. That has to stop, my sisters and brothers. We're sick of our family members and neighbors getting denied coverage because they once got sick. That has to stop. We're sick of insurance company policies that reward denying claims. That has to stop. And we're sick of using our premium money to work against the health care reform we need. We're sick of them telling their employees to join the town hall screamers against health care reform. Let's have a civil discussion in this country, and when we have a civil discussion, Americans say they want health care and they want it now. down. And I am so proud to be here with you today saying to these big insurance companies that we're what? Sick of it. Now let's be clear. Saying we're sick of it right now, we're saying it, sounds good, it fires us up, but we know that is not enough. Organized labor, along with you, has always been in the forefront of the fight for health care, and we're waging a major campaign across the country to make sure that all workers win, that all our communities win. I'll say it again, that all of America wins. We are going to do something about it. Now in 2009, it is our time. We are going to get it right, and we're going to get health care. Now, since we are here in Philadelphia, you can say that today, September the 22nd, people gathered for a Declaration of Independence from big insurance companies, chokehold on our health care. That's what health care reform will mean. The CIGNAs and the WellPoints and United Healthcare and the rest of them won't be calling the shots anymore. It's about time that we call some of the shots. Here's the way we see we've got to do it. America's in a big fight over health care. The American people are on our side. Big insurance is on the other side. Only one of us will win. Will we win? I say we must win. We cannot afford to lose. There are 50 million Americans depending on us all having a victory. But we're going to win because we know it is time for action. The insurance companies thought they could hide behind all the town hall screaming. It is not going to happen. The insurance companies thought that health care reform would get shouted down and they would not have to face the music. And that's not going to happen. We, the people, will not let it happen. We, the people. You know that phrase, all of you from Philadelphia, don't you? And here's another. The closing words of the Declaration of Independence. We mutually pledge to each other our lives, our fortunes, and our sacred honor. Why are we sick of big insurance? They take away our lives. They take away our fortunes. They take away the sacred honor of our country. Enough is enough. It is time for action. Today, we're going to hear just a little piece of the story of what big insurance is doing to all of us. I could give you a bunch of statistics, but I think you know them all. A doctor once said that statistics are people with the tears wiped away. And those tears come from what CIGNA and their corporate friends are doing. Nobody can tell this story better than doctors and patients. Congress should be paying attention to them. They've got to listen to Americans. We want to hear their stories. Let's get at the going, brothers and sisters. Let's do what's necessary. Enough is enough. We're sick